Lawmakers in our region are working to change the process required to open new medical facilities here in Tennessee. Thank you for joining us tonight. I'm Terry Craig. Several local lawmakers are calling for action that could make it easier to expand health care options in the region. News Channel 11's Catherine Simpson reports on what lawmakers want changed.
State Representative David Hawk told me he did the event today in part because he thinks health care here in Northeast Tennessee could be better. I spoke to attendees who say they agree.
I fell in March, the middle of March, and I have not seen an orthopedic doctor yet, and I've got 2 torn rotator cuffs in my right arm.
Jonesboro resident Kathy Worley is among 103 attendees at a policy brunch on health care over her concerns about medical care in our region.
There are some lack of services.
State Representatives David Hawk, Bud Holsey, and Timothy Hill spoke at the meeting focused on certificates of need, or CON. It's the approval process required to open new hospitals and other medical facilities in the state. Already this year, the General Assembly reformed the process, allowing for some emergency departments and other facilities to open without a CON. But Hill says that wasn't far enough.
There's nothing that is stopping us from continuing to go after the full repeal, which is good.
Hill, along with Hawk and Holsey, say the end of CON would create competition and drive down prices in the region.
We need some changes across the state of Tennessee as the certificate of need is drawn to allow our citizens, when they're healthcare patients, to go see their doctors in whatever hospital setting they desire necessary.
The elephant in the room, if the CON process ended, it would allow potential competitors to open in the area where Ballad Health currently operates a legal hospital monopoly. News Channel 11 reached out to Ballad for reaction to the calls for repeal. CEO Alan Levine wrote in part, quote, "As with any proposed legislation, we would have to make sure the public understands the benefits and possible consequences of whatever is proposed. One thing we do know is that our communities would prefer to see their hospitals remain open, and we would support efforts to make sure that happens." Reporting in Jonesboro, Catherine Simpson, News Channel 11.